What kind of dog do you find in a bakery? Bless you. That's not the kind of dog. What kind of dog do you find in a bakery? A purebred. Okay. What happens when you eat yeast and shoe polish? What happens when you consume or eat yeast and shoe polish? You rise and shine. Don't try that at home, though. Did you ever hear about that movie called Constipation? It never came out. Never came out. Some of you are confused by that one. All right, have your neighbor explain it to you. All right, we're going to back up, and I'm going to ask you some questions that were homework assignments. Do you remember this? You're like, oh, right. Righto. Homework. Cheerio. Who would like to tell us the answers to what you filled in on these boxes? The difference, we're comparing and contrasting general and special senses. Any volunteers? Hopefully they're volunteers, otherwise I just call on people. Give me some characteristics of general senses. Uh-oh. Remember in high school, it was like, uh-oh, it's time for a pop quiz. Take out a sheet of paper. You guys remember that? No? Your high school didn't do that? Amara. Okay, so pressure like the Meisner's corpuscle. Generals, I would agree. What can you tell me about its location? So Amara said general senses would be like a pressure sensor, like the Meisner's corpuscle. What can you tell me, and I agree, what would you tell me about location of that? Where would you find it?
Skin.
In skin? All throughout the body? Yeah, for the most part. So it's widespread location throughout the body, in the skin. You have a lot of skin. Some other examples might be heat, cold, general senses. What's another one that we talked about at the end of the lecture on Monday? The very end. Pain. That's a general sense. You can feel pain pretty much everywhere. We talked about referred pain, right? And we had a lot of questions at the lecture and after lecture on referred pain. A lot of anecdotal examples of that. Okay, that's pretty good. Over on the right column, under special senses, give me some examples or characteristics of special senses. Those are more cranial nerves, like hearing, smell, or olfaction, vision, or sight. I would agree. So what can you tell me about their location? You find them everywhere? Where do you find them? Where? I see neighbors pointing to people. yeah, your neighbor's pointing to your head. That's right, just in the head location. So that's kind of where we are today. Okay, the next homework assignment. So can you anticipate that there might be some sort of test question about comparing, contrasting, or some of the differences, where you find them, what they do? I asked for some examples of transducers because oftentimes, and you'll find this as you move on in your studies, right? And then eventually you're going to move on and you're going to be treating people. Most of you, probably 90% plus of this classroom is interested in taking care of people, which is awesome for me because when you guys are professionals, I'll be old and I'll be your patient, right? So I have like motivation to make sure you understand and learn this material. So what are you going to tell the average individual, your average patient, about how a sensor works? Like why something's not working? It's this transducer moving energy from one form to another. That's all it does. So what are some other examples of transducers? I just want to see if you can make some of those parallels. Some other examples of transducers. Solar panels. Taking light, turning it into electricity. Right? Broad spectrum white light, UV radiation, taking it to electricity. What else? A speaker. Absolutely. Right? It's taking an electrical signal, an impulse, and it's turning it into a mechanical vibration. You're like, really? It's like, yeah. The vibration of the speaker sends waves, sound waves, that move through the air, and that's how you interpret, because that pushes pressure on your eardrum. Right? Fun fact, one of your colleagues came up afterwards. We were talking about cochlear implants, talking about eardrum implants. Right? Has had an eardrum implant, a couple of them, which I thought was pretty cool. I'd never actually met somebody that took place, and I've read about them. So, a speaker, another transducer. There's a hand over here. Kinetic energy, so you could go potential energy into kinetic energy. Yeah, absolutely. Absolutely. I mean, that's the concept of a water tower, right? All of you that grew up maybe in smaller towns have water towers. Why do they put the water in a giant tank way up high? Anybody ask that question? Curious? Why do they do that? Why don't you just store it on the ground? It's easier to get to. Why is it like 300 feet in the air with the name of the tiny little city on it in your elevation, right? Why do we do that? Why do we put water way up high? That's a form of a transducer. What are we trying to do? Nobody knows? Give something for high schoolers to climb and write their names on. It's true, but it's more important than that. You're storing a bunch of water at an elevation with the force of gravity. That's potential energy. You open a valve, you've created water pressure, enough pressure to actually pressurize a small town with water pressure. You take for granted, you open up the faucet and water comes out, right? Well, if there's no water pressure, then you have no water coming out of your faucet. Another transducer example. Anything else? There's hundreds of examples, folks. Right? And all the stuff that we've invented are some derivation, if you will, of kind of biologically the way our sensors are designed in our body. Okay? So I think it's just kind of a fun exercise for you all to see the stuff we're talking about really isn't all that complicated. So today we're going to be into chemical sensing or chemosensation, and there are two, right? We sense chemicals by what two anatomical structures? What are they? You can point to one. You can stick out the other, right? Your tongue, really more of the oral cavity, as well as the nasal epithelium. Upper left is not a taste bud, but it's a papilla that's found on the tongue. Have you ever wondered why the tongue kind of looks so gross? It's it's rough. It's kind of nasty. Sometimes it's got weird stuff, color on it, right? Sometimes it's wet, sometimes it's dry. The tongue's kind of a weird structure. So these are part of the bumps and ridges of the tongue under a scanning electron microscope. Now, we interact with our environment through chemical interaction using the nose and the tongue. A lot of insects. I was talking to one of your colleagues about the kind of research I did when I was actually where you are. I worked on neurobiology, and I mapped neurons in an invertebrate model to the brain of the olfactory lobe in a Manduca sexta, which is a tobacco hornworm at the University of Arizona. It's really cool research. And we were finding pathways of the neuron back to the brain. And the Manduca have these really pronounced antennae. And their antennae are how they sense chemicals in their environment, how they find flowers, how they find plants, how they find a mate. It's their tongue and their nose, essentially. More of their nose, really, than anything. Other insects have a proboscis, like a really long tongue that comes out. So this is how we interact with our environment. We get chemical information about our surroundings. There are certain things that we're like, that smells weird, and you start backing up, and maybe because it's toxic, right? Or you taste something, that milk has turned. I'm not going to drink the rest of that glass, okay? Now, 2,000 years ago, it was really important to be able to understand that. You're interacting, you're foraging for food, right? You're gathering, you're hunting. Is the meat spoiled? Is the fruit spoiled? So this is how we interact with our environment through chemosensation. And other organisms do it in a lot of other unique ways, which is kind of fun and cool. Incidentally, the olfactory region of the moth that I worked on was about 60% of the brain volume. It was a really good smeller, but that's about it. Okay? All right. Moving on. Taste. Gustation is the terminology that we use for taste. Sensations that result from the action of chemicals on taste buds. The picture I just showed you is not a taste bud. The picture I showed you is a papilla. It's a lingual papilla. These are found on the tongue, giving it its texture. They're actually found on the back of the tongue as well. And the taste buds are buried, and I'll show you in a minute. The taste buds are buried in the crevices of the papilla. We have about 4,000 taste buds that are, mostly on the tongue. 10,000 in total, so there's about 6,000 additional that are found on the inside of the cheeks, on the soft palate. The soft palate is if you put your tongue on the roof of your mouth and you feel towards the posterior aspect, it feels pretty hard. Most of us can't get our tongue that far back. You kind of have to put your finger in there. It turns soft. You lose that ethmoid bone, and that soft palate, before you get to the throat, and if you do this, you might gag yourself, so be careful. That's where you have taste buds, in that soft palate region. You also have them on the pharynx, that's the back of the throat, as well as the epiglottis. So, wine tasting. Anybody done any wine tasting or seen it? All right, so there's a lot of swooshing, right? There's smelling. We'll get to that here in a second. Swooshing. Actually, with wine tasting, I think it's kind of, sort of a waste, but if you're doing it for an entire day, you won't remember what you did if you don't, swoosh and then spit it out, right? So they'll swoosh to get the flavor, talk about the oakiness, all this kind of, posh stuff. And you're trying to get as many of these chemical sensors to actually receive the flavor. Okay, on the tongue, we call them a lingual papilla. Filiform, folate, fungiform, and valate. And I showed you a valate on that first picture. The filiform don't contain really any taste buds. They give you a lot of information about food texture. And the lingual filiform papilla, you can kind of appreciate, where are they? I just saw them. Well, they're actually going to be located kind of throughout. This picture doesn't identify them. The folate, again, no taste buds, but they're really on the ridges, on the ends, the sides. The folate comes from leaf. Foli means leaf. So they're leaf-like. Their taste buds typically degenerate in your tongue by about 2 or 3 years of age. So you're born with taste buds in the folate, but then they disappear, which is one of the reasons that our taste buds do change from childhood or infancy to adulthood, right? And having more sensitive taste as a young infant, there's a survival benefit to that, where you're more sensitive to spitting something out if it seems weird. Okay, as you get older, you have better discrimination capabilities, and you can say, I'm reading the born on date, this milk is probably bad, it's expired. So these are kind of weakly developed in humans. They're more pronounced in other mammals. Fungiform, fungi from the mushroom shape, so they kind of have a stalk and kind of a big head. They're widely distributed throughout the tongue, but they're especially concentrated at the tips and at the sides of the tongue. And then valate is a word that means wall-like, also referred to as circumvallate. And they're towards the rear of the tongue. They're really big. They're large papilla that contain about half of all the taste buds towards the posterior aspect. Presumably having taste buds at the back of the throat and around the soft palate and the back of the tongue right before you decide to swallow it is a really good time to decide if you're going to consume this or if it's poisonous, right? Right? The filiform, I want to go back to texture. How many of you have a vivid memory of a food that you've tried where you're like, it just feels weird? Yeah, right? Octopus, squid, what else? Mushrooms, broccoli. I cannot stand broccoli, never have. And my wife tries to get me to eat it, and now I'm like, I'm an adult, I don't have to eat my broccoli. Serious. I mean, it's true, right? Make me. You can't make me eat my broccoli. Filiform, thread-like. The texture here is really, really important for us. And so all of us have some, anecdotal stories about, foods that just they feel weird. And it's hard to explain that, but that's where that's coming from. Okay, all of the actual taste buds look alike. So now we're going to dive in. So you can see this upper right picture is the picture of a papilla. And if we go kind of into the crevices, we're going to start to appreciate, and you saw some of these slides in lab. And now this is where lab and lecture kind of regroup. You just finished up lab and you're finishing up special senses there, or just completed them. And that's what we're talking about now. So I know you've seen some of this histology, but down in this pore, you see a taste bud that's highlighted in this histology. And this is a schematic or a cartoon of that taste bud. And here is the taste pore. And you've got a taste bud that's made up of taste cells that are conveniently colored in purple, and supporting cells that are conveniently colored in blue. Now, clearly the supporting cells, like we've seen this motif before, right, in our nervous tissue, like glial cells or supporting cells. The taste cells are the ones that actually have the synaptic vesicles that innervate onto sensory nerves that go back to the brain. The supporting cells don't. And the taste hairs are more of epithelial hairs that just try to encourage the chemical molecule to come in and bind. So these are lemon-shaped, or they kind of look, I think a little bit like an onion. They're in groups of about 40 to 60 taste cells and supporting cells, as well as what we refer to as basal cells. You see this purple one? What do you think the basal cell does? Based upon what you already know from this class. Any takers? It regenerates. Where did we see basal cells? Nice job, Silas. Where did we see basal cells? Epithelium. So this is our stem layer that actually turns over every 7 to 10 days. How many of you love pizza? Yeah, let's see it. Come on. I mean, it could be gluten-free pizza, right? No cheese, whatever, but pizza. Okay, now I just got to know, Flagstaff. How many of Fratelli's fans versus Namarco's? Let's see the Fratelli's first. Fratelli's. There's a authentic Fratelli's fan in the very back. That hand went up before I even finished the question. All right, Namarco's. Oh, okay. So I think Fratelli's has it. How many of you have had it too quickly, and it burned the roof of your mouth? You can't taste food for a few days, right? Well, the turnover is every 7 to 10 days. So fortunately, if you consume that pizza too fast, it comes back pretty quick. And that's the basal cells. That's the stem layer that turns over and replaces your taste cell every 7 to 10 days, so about every week. The supporting cells, they look like the taste cells, but they don't have any synaptic vesicles and they don't play a sensory role. So this is critically important. To be tasted, actually have the sensation of taste, the molecule, the chemical, has to be dissolved in saliva and flood the taste pore. So that's what goes in that blank. So you actually you release saliva, which is mostly water, to dissolve the chemical, get it into solution. What that means when you dissolve and go into solution, it's like a glass of tea, and you put a scoop of sugar in it, and then you stir, and it goes into solution. You can no longer see the sugar. So that's what's happening in your mouth. That's also what's happening in your nose, and we'll talk about that here next. What goes in the blank is to be tasted, molecules must be dissolved in saliva, and then they flood the taste pore. So they have to go into solution. You have 5 primary sensations, and again, this is a little bit overlap with lab, so again, I think that's why this unit is pretty comfortable for us. Test scores tend to be the highest, which is woohoo, right? Everybody needs that right at the end. You've had it twice now. We have salty, sweet, sour, bitter, and umami. All of these are pretty self-explanatory except for umami, which is that the flavor of what amino acids give you. That's that meaty flavor that's like in chicken broth or beef broth or a vegetable broth. But backing up, salt, what you're detecting is when sodium and potassium ions in your food bind to the taste cell, trigger an action potential. Sodium and potassium in the food gives you a signal to the brain of salty. When sweet, anything associated with carbohydrates. Those could be simple sugars, monosaccharides, disaccharides, polysaccharides. Anything that's associated with a carbohydrate typically has a high caloric value because a lot of ATP can be generated. It triggers the brain with a sensation of sweet. How many of you have a sweet tooth? Come on, let's be honest. Sweet tooth? Okay. Right? And there is, you taste something sweet and it's like, ooh, there's like a pleasure response in the limbic system. And that's actually been studied in research. Chocolate has the same effect. Some of you are like, ooh, yeah. Speaking my language now. So sweet, evolutionarily speaking, if you think about this 5,000 years ago, 10,000 years ago, for humans, finding food was a lot more complicated than today. And so understanding that has a little sweet flavor to it, that's pleasurable, it tastes good, because that has high caloric value, because you're getting a monosaccharide, a disaccharide, or a polysaccharide. And those are words that you understand now, right? Those are words from Unit 1, folks. Monosaccharide, like glucose. A disaccharide, like sucrose. A polysaccharide, like glycogen, right? Or cellulose. Sour. Sour, the citrus acids that are found in fruits and some vegetables will bind to these taste cells and trigger a response or an interpretation in the brain of sour. Bitter, things that are alkaloid in nature, things like nicotine, caffeine, quinine, and morphine, they have a bitter association with. Usually things that are spoiled are going to have a breakdown product that has an alkaloid byproduct, and you taste it bitter, and you say, I'm not putting that in. And then umami, right? This is sort of that chicken broth, kind of a comforting feel. Now you're actually consuming amino acids, which are almost as valuable as sweet. So how many of you are more of a, I'd like something salty and more like, crackers and, salami as a snack versus like, candy? How many of you are more like salty versus sweet? Yeah. Now, both of those have high value for us as organisms because amino acids are the building blocks of protein. So if you have protein available in your diet, that umami flavor or that taste, it doesn't just mean meat, right? I mean, you can have things that are rich in protein, legumes and beans and things that you might find that you're foraging that actually have that amino acid background that are going to help with building muscle tissue, because that's what our muscles are built out of. So it's popular to show a picture like this lower right, where you see this chart of the distribution of these taste cells. Now, the best way to interpret this is there are regional concentrations where they're higher in concentration. For example, the tip of the tongue, there's more per square micron, per square area, there's more taste cells that are of the sweet variety on the tip of the tongue. It doesn't mean you can't taste or there aren't taste cells of other flavors. It's just the highest concentration of sweet happens to be on the tip of the tongue. So the way to interpret that is bitter isn't only in the back, but there's a high concentration of bitter, which kind of makes sense. Right before you decide to swallow it in the back of the tongue, if it's bitter, remember that's the alkaloid, that's the spoiled food, that's something that might be poisonous, right? So you kind of have this last, but you can still taste it on the tip of the tongue if it's bitter. It's just higher concentration of those receptors are found at the back of the tongue. So taste is our perception of taste. Our perception of taste is influenced by, and this is why I gave the example of texture, like a food that you just don't like the texture, right? Because you could use it in other, like for example, like broccoli. I don't mind broccoli like if it's cooked in certain dishes. It's actually really, but then it's softer and it has, some sort of broth or some sort of, marinade, or it's with, another vegetable. I just don't like it in my salad. I don't like raw broccoli. But cooked broccoli is much better. The texture is totally different. So taste is a combination of texture of food, aroma, and we'll talk about that next, temperature and appearance, right? How many times, we have 4 kids, and when they were little, there were so many times, our rule was you have to try everything. You have to try everything. You may not like it, you got to try it, okay? And how many times do the kids say, I don't like it? Well, why? It looks gross, right? What does that have to do with how it tastes? Close your eyes. But this is all part of the taste. So having a mouthful and deciding when you're going to swallow and create a bolus that goes down the esophagus into the stomach, and then you'll pick this up in 202 when we talk about digestion. This is detected by the branches of the lingual nerve in the papilla. So they feel that pressure and that sensation to determine that's about enough food that's in my mouth right now, right? And social cues help with that, like, hey, so Johnny, I think you have enough in your mouth. You should probably just finish chewing that and then swallow, right? But that feedback loop is coming to the brain from the papilla and these branches of the lingual nerve. Question over here.
What was happening to some taste buds during COVID?
Oh, yeah. So COVID, we'll kind of get to that later, but I'll talk about it now. So there are certain types of viruses that will actually cause inflammation of nerves. And in COVID, it was influencing smell and taste. And certain smell and taste went away because those nerves were actually inflamed by the COVID virus and interrupting their ability to send an action potential back to the brain. How many of you had that happen? You had COVID and you lost the sense of taste or smell on certain things? Or some things tasted disgusting. You're like, oh my gosh, it tastes like metal. Right? Maybe that's what I should tell my wife. I think it's COVID. Now broccoli tastes like garbage. Hot peppers stimulate branches of free nerve endings in the taste buds. So what are these receptors that hot pepper is stimulating in your taste bud? They're nociceptors. So spicy, how many of you like spicy food? That's right. That is not a taste. That is pain. You like some amount of pain. Me too. Right? Isn't that fascinating? Like, you want your sriracha on your eggs or whatever, right? That is not a taste. That is a pain sensation. All right, so two mechanisms of action. There's two mechanisms of action as we kind of wind up taste and we'll move into olfaction. And they're intimately connected today, and that's why we're talking about them today together. We've got two mechanisms. We can either activate via second messenger systems or we can depolarize the cell directly. That should be a theme that is embedded in your brain because we've talked about that in many different applications throughout this semester. So activating a second messenger system, just to repeat, what that means is something binds to a receptor on the surface, and then it sends a signal inside the cell to trigger a cascade of other signaling molecules, such as cyclic AMP, to actually trigger intracellular things to happen to propagate the action potential forward. Whereas, in contrast, if you depolarize the cell directly, for example, sodium binds, opens a channel, sodium floods in, and that causes a depolarization event, which is what we've mostly been learning about, right? So this mechanism should make a lot of sense. This mechanism, when we activate second messenger systems like cyclic AMP to G protein signaling, we haven't talked a lot about those, but those systems are things like sugars, alkaloids, and glutamate. And those are the ones of sweet, bitter, and umami. Those are second messenger systems. Sodium and acids, sour and salty, depolarize directly. But regardless of which pathway you use, it would probably be wise to know those two categories for the exam. Like which one of the senses of taste are through depolarizing directly, right? Salty and sour. Which ones are through second messenger systems? Sweet, bitter, and umami. I would know those two different lists. But either mechanism releases neurotransmitters at the back that stimulate dendrites on the base of the taste cell to trigger an action potential on the nerve. So you get the signal going back to the brain. Now, when the inflammation of these nerves subsided post-COVID symptoms, your sense of taste returned. Your sense of smell returned. In a small population during COVID, small population of patients, they lost it indefinitely. Remember that? Maybe you know some people like that. Well, that nerve was damaged beyond the ability for the body to repair it. And the inflammation was too aggressive during that COVID virus. Okay, so taste. Our last slide on taste, and then we'll move to smell. I'm going to describe these three nerves. The facial nerve as 7, This is collecting information from taste buds over the front or the anterior two-thirds of the tongue. The glossopharyngeal nerve from taste buds over the back one-third or the posterior aspect of the tongue. The glossopharyngeal nerve is cranial nerve 9. And then the vagus nerve, which cranial nerve is the vagus nerve? Do you remember? 10. Vagus nerve from the palate, the pharynx, and the epiglottis. So that's how your cranial nerves utilize or interface with your outside environment to bring in information, critical information about chemosensation, just for taste, gustation. But how many of you have had a head cold, maybe recently, and nothing tasted good? You're all plugged up, you can't smell, right? And nothing tastes good. Why is that? Because smell and taste are intimately connected. In fact, your ability to smell is far more precise than your ability to taste. Olfaction, known as the sense of smell, is far more discriminatory. Your ability to decipher different chemicals is much better with the olfaction capability due to the fact that you have about 10 to 20 million olfactory cells, neurons, epithelium, and supporting stem basal cells. So it's organized very, very similar to what we just talked about. So again, another piece about this section is, there's 5 senses that are special, but 2 of them are pretty much the same, right? Basal cells here do the same thing that they did in the tongue. The mucosa of the superior conch, nasal septum, and the roof of the nasal cavity covers about 5 square centimeters. 5 square centimeters is pretty big, right? For us Americans, we're like, a centimeter, how big is that? Well, there's about 2.5 centimeters, right, in an inch. So it's about 2 inches by about 2 inches. That's a 2-inch by 2-inch square, about like that. That's how much mucosa you have on the roof, nasal cavity, and the conch. Your nose is not that big, right? Isn't that kind of funny? You're like, wow, how do you pack that much in here? But that's the area that's designated for chemical sensation. About a 2 by 2 square area. On average, there's 2,000 to 4,000 different odors that can be distinguished. Different smells from you and I. We have 5 tastes. We have nearly 4,000 smells. Crazy. But when you put them together, and like for a really nice meal, it's unbelievable. And I'm just grateful that, it didn't have to be this elegant. Right? Food didn't have to be this enjoyable, but I'm very grateful that it is. So let's take a peek at how this is organized. Let me show you this schematic over here. So this is airflow. This is basically in your nostril, the open space or in the conch. And this is the air. And these little green dots are chemicals. A flower. Right? Deodorant, dirty socks, you name it. And the olfactory hairs are actually covered in a moist mucus. Why? Why is that important? Why is that important? Because the molecules have to be dissolved for you to actually detect them. So in the mouth you have saliva, in the nose you have a mucus that covers. Now the other nice thing about the nose and the mucus is it actually catches particulates, dust, debris, preventing it from going down into the lungs as a filter. So it's actually better. In fact, how many of you are exercise science focused, right? So as you move into exercise physiology, you'll talk about elite athletes like runners. And part of the training is breathing. And one of the things that we do with elite athletes that are working on respiratory training is try to breathe in exclusively through your nose. Why? This is one of the reasons. It filters the air. The other thing that it does is it actually warms the air before it goes into the lungs. Because the way the airflow comes into the nose and the nasal conch is it comes in a turbulent fashion that warms the air, and it actually throws the chemicals all up in the epithelium to find a binding site, get stuck in the mucus and then dissolve and actually find the olfactory cell. You can see there the supporting cells right next to it in purple. And then, of course, you can appreciate the basal cells at the base that regenerate, just like we saw with the tongue. So these guys look like little bowling pins, or they're kind of like fat in the middle and narrow on top. The head of it has about 10 to 20 cilia or hairs, and we call them olfactory hairs. Those hot hairs have a binding site for the chemical, the odorant molecule or the chemical, but they're non-modal, meaning there's no mechanism to make them move. They're not trying to encourage the chemical to bind. They just respond to the chemical that lands in the layer of mucus. So, if you're sick, you have a sinus infection, you have a head cold, runny nose, you're congested, plugged up, that layer of mucus is thicker. How easy is it for the chemical to dissolve and get to the olfactory cell? Easier or harder? If they have a thicker layer of mucus. Much harder, right? So that's why when you're sick, nothing smells good, nothing tastes good. Back to the wine tasting example. That's why with wine tasting, one of the first things you do is you actually smell the wine. And a lot of times, people that are very well trained, I have a couple buddies that, they're way too experienced with wine, in my opinion. I'm like, red and white, right? I'll have 2 glasses of each. No, I'm just kidding. So the complexity of smell is much greater than it is for taste, but they're intimately connected. So these olfactory cells, the basal end of the cell becomes the axon. The basal end of the cell becomes the axon. So the axon now collects into these small fascicles on the backside, and they leave the cranial cavity through this cribriform foramina and the ethmoid bone. And you learned about that when you studied the skull in 201 lab. These fascicles that come out the back are collectively referred to, if you put them all together, they all run into cranial nerve 1, which is the olfactory nerve. That was the nerve I was studying in the moth. And that olfactory nerve went to the olfactory part of the brain that was like more than half of the brain. Nearly 60% in the moth was designated for just this purpose. So, in essence, the only neuron in the body that's directly exposed to the external environment is found in the nasal epithelium. These olfactory cells are the only neurons that are exposed to the outside environment because they're pushing out into, with their hairs, into the airspace of the nose, and they're contiguous. There's no neurotransmitter. They're contiguous with the axon. Whereas in the taste cells, we actually use neurotransmitters, right? Either directly depolarized or we use cyclic AMP. We use neurotransmitters to send the signal. So this little factoid might be nice to know for the exam, like what neurons in the body are actually directly exposed to the outside environment, which is kind of a cool question. Everywhere else in the body, nerves are covered, not in the nose. It's actually very, very risky, right? But you have basal cells that turn it over. So the basal cells continually divide into new olfactory cells. The original ones have a lifespan of about 2 months. So the turnover here is a little slower. So like in COVID, a lot of patients said, well, my sense of taste came back before my sense of smell. but it was kind of hard to tell because still nothing really tasted good. Now, and the reason for that is because the basal cells in the smell take a little longer to turn over. The basal cells in taste are a little faster, but because these are so intimately connected, and they both go to what lobe? What lobe? Temporal lobe, right? Special senses here go to the temporal lobe. But we have this ability for stem progenitor cells to turn over and replace damaged olfactory cells. Okay, the sense of smell is really critical. This is a picture of our dog. This is Nori. But what I wanted to propose here is I've characterized the ability of you to tell different smells over tastes. It's like 4,000 to 5. 2,000 to 4,000 different odors versus 5 tastes. So on average, dogs have up to 100 million more olfactory receptors in their noses. 100 million more than us. Bloodhounds specifically, Nori's not a bloodhound, but 300 million more. So a dog's ability to detect chemical odors or smells is far superior than ours. Same as a tobacco hornworm, the Manduca sexta moth. Same type of, and that's an invertebrate. That's an insect. Now I'm talking about a mammal here. Nori's she's a Portuguese water dog, and her sense of smell is absolutely keen. It's unbelievable. We had a retriever, and I think the water dogs have even a more astute sense of smell. It's kind of unbelievable. It's crazy. Women tend to have, on average, these are averages, more sensitive to odors than men. Smell and odor interpretation has a lot of social implications or interactions. There's a lot of social differences amongst cultures based upon what smells good and what doesn't smell good. The odorant molecules bind to the membrane receptor in the olfactory hair. If it's hydrophilic, that means if it's water-liking, it diffuses right through the mucus. If it's hydrophilic, if it's water-liking, that's what that word means. If it's hydrophobic, it fears water, it doesn't like water, it actually needs to be transported by an odorant binding molecule through the mucus. So your perception of hydrophilic chemicals is faster than hydrophobic because you don't need a transport molecule to move a hydrophilic chemical. These activate G protein and cyclic AMP systems. These are second messenger systems. So there's no neurotransmitter. It's a second messenger system. And it opens the channels for sodium or calcium to help depolarize the membrane and allows for an action potential to be sent to the brain. These action potentials go to the brain, but olfactory receptors adapt extremely quickly. So you've got what's called synaptic inhibition in olfactory bulbs. So synaptic inhibition is, if you remember kind of our first lecture on sensory, we talked about phasic versus tonic adaptation. So let me illustrate. Another way to say this is the pathway for a smell becomes saturated and you adapt to it where you no longer smell it until you refresh and then you can smell the chemical again. So, how many of you have siblings? I have 2 brothers. There were 3 boys growing up. And we used to like to wrestle, and we would get a little rough, so we would find somebody's room that we were going to destroy, one of the brothers, and that's where we would wrestle until Mom, found out and said, stop wrestling because someone's going to get hurt. Well, we would shut the door. So we'd be wrestling for, an hour, bouncing off the walls, just doing what young boys do. And Mom would open the door and go, oh my goodness, it smells so bad in here. It didn't smell to us. We was like, all right, you got to stop. We'd leave. If we walked right back in, you'd be like, oh my gosh, it does stink in here. Have you ever had that happen? where you can't smell something, or you walk in a room, it stinks when you walk in, and then after a while you're like, well, I guess it doesn't smell anymore, right? Cigarette smoke or whatever it is, right? A perfume or a cologne. Then you walk out and you come back. That is this synaptic inhibition that takes place after adaptation to a constant stimulus to that chemical sensor. So they adapt really quickly. And that's actually good because you want them to adapt fast because you can reset them and actually smell again quickly. And that helps you to be on your toes for the third bullet point because some odorants act on nociceptors of the trigeminal nerve. Now, the trigeminal nerve is the fifth cranial nerve 5, and things like ammonia, methyl, chlorine, and the capsaicin of hot peppers, these actually stimulate nociceptors or pain receptors on cranial nerve 5 or the trigeminal nerve, giving you an indication that maybe something is unsafe. So, I mean, you can taste spice, but you can also smell spice, right? Right? And that's why, because the nociceptors are in both locations. So this was the question that came earlier. Some viruses, like COVID-19, can cause a lot of congestion and swelling, which interferes with these molecules reaching the receptors. And then in some cases, the viruses can cause dramatic inflammatory damage to the olfactory sensory neurons. And it can be to such an extent that it's permanent and it never comes back. And that's what we saw a couple years ago. Okay. That's what I have for you today. We're going to pick it up with hearing anatomy on Monday, and then we'll finish out vision on Wednesday. I hope you have a great rest of your week. Anybody going to be at the UGrad Symposium on Friday? Anybody? Sweet. Yeah, that's right. Jay, you probably have a poster, right? All right, I'll come find you. I'll have 5 students there. Have a good one.